Yes, they say that laughter is the best medicine, but allergies are no joke. Dr. Vincent Eletto, emergency room physician at JFK Medical Center, joins us now to talk about how what you know about your allergies can save your life.
Absolutely. Allergies could be devastating. They could be very mild. Nothing more than itching of the hands and the feet to total devastation where your throat closes off. You can't breathe, wheezing occurs. This could be extremely severe, and people must be aware of this.
I understand a lot of people have food allergies that they may not be aware of, and you get some of these people in the ER saying, hey, I had a piece of fish, and all of a sudden, bam.
Oh, that's correct. And some people mistakenly think that, well, I haven't eaten it for many years, so perhaps I grew out of it. You don't grow out of these allergies. Allergies are actually a chronic illness. They stay with you.
So how does one find out? I mean, sometimes you have things that you grow up with in childhood, but some of these things come on in adulthood.
That's correct. One can become sensitive to these things over the years. One may never have been allergic to it, and all of a sudden they do become allergic, and you don't have to be allergic to something to have that allergic reaction. It depends on the quantity that one eats. Specifically, while I was studying one time in school, I sat down with 2 or 3 pounds of bananas, and I started eating them, and the next morning I woke up, I was a red balloon. I itched all over the place, I had welts all over my body, and it was just the quantity that caused my body to react to it.
So how do you know when someone arrives in the ER that this is the case? I mean, you've got to do a quick history of the patient while they're in pain or can barely breathe.
Unfortunately, you don't. You try to take a very good history. People oftentimes aren't aware that they may have eaten something because it was minor. They just picked something up in a store, chomped on it, and the next thing you know, they're having a reaction. If you never get stung by a bee, you don't know that you're allergic to that bee.
Right.
And the problem is, with each subsequent reaction, it becomes worse.
Now, are there people who are more at risk for developing allergies, or is it across the board?
You know, not really. It's just across the board. However, interesting statistics is that if you were breastfed as a child, you're going to be less prone to allergies. And we believe it's because mom conferred some immunity onto you against these allergies.
Interesting. So that there's an argument there for breastfeeding for
Absolutely,
young moms.
absolutely, and has been a good argument for quite a while.
What about the most common form? I mean, you see these things in the ER. What are the most common type of allergies you see?
Seafood. Seafood is a very common allergy, and most people, seafood is delicious, and most people come in saying, I just had some shrimp, peanuts, and people don't realize that there's peanut oil that's cooked with. So when you go to a restaurant, especially Asian restaurants, you might want to ask if they're using peanut oil, if that's an allergy that you happen to have.
Now, when you talk about seafood, is this across the board or certain types of seafood?
No, it seems to be across the board,
Wow.
actually. And these things tend to become worse and worse. Personally, I had a patient that I saw often who had a seafood allergy, and all he would have to do is actually smell it. And he would begin to react, and his reactions got worse and worse as the years went on.
Now, to people who have specific types of allergies, like peanuts or certain oils, might it be good for those folks to always read the label when you're at the supermarket? Because there's a lot of things that are buried in food that you don't know about.
Absolutely. That's one of the key things people have to do, is to stay away from the triggers, the things that cause these allergic reactions. They have to be aware of them and completely stay away from them.
Are there differences between food allergies and maybe something that's environmental, that you touch or you breathe, or seasonal allergies?
Seasonal allergies tend to mostly cause, nasal stuffiness, congestion, eye irritation. Those aren't so bad. Most people live with those. They take antihistamines, prepare themselves for the season. The food allergies tend to be much more severe. They set off the cascade, if you will, of events where the chemical releases within the body are profound, and we release all these histamines and chemicals that just cause our body to swell, the blood pressure to drop, and this is where it gets to be devastating.
It's dangerous.
Within 15 to 20 minutes, if you're reacting to an allergen and you begin to feel chest tightness and difficulty breathing, you feel very anxious, get yourself to an ER. You truly need to be treated. Don't self-medicate.
Are there remedies that you can take beforehand, much the same as if you know you have indigestion for certain things, you take something beforehand? Is that doable for an allergy?
Well, we oftentimes need contrast to give people a contrast for a certain test, a CAT scan or whatever, and some people are allergic to the contrast material, so we pre-medicate them. We give them the antihistamines like a Benadryl and steroids, and that blunts the response. But I don't advise people to do that just to enjoy, you know, perhaps mango shrimp. It's not a good idea.
Not worth it.
No.
Well, Doctor, always insightful. Glad you could come by again.
Oh,
and
it's
we'll
my
look to
pleasure.
get more insight the next time.
I thank you.
Thank you.